Hello, and welcome to our second Spectrum Health School Health virtual series. I am Lisa Lowry, Section Chief of Adolescent and Young Adult Medicine at Helen DeVos Children's Hospital Spectrum Health. In this virtual chat series, we are connecting you with community experts to answer the questions that are most important to you regarding COVID 19 and the back to school season, whether it's in person or virtual. In this session, we'll be focused on mental health and our students. The COVID 19 pandemic is stressful for many people, and it has caused fear and anxiety as our routines have been uprooted. This can be overwhelming and very emotional, not just for adults, but also for our children. Research shows that reports of anxiety, depression, and suicidal ideation are significantly up this year when it has been compared to previous years. Tonight, our experts are going to address this uncertainty and give you some ways to help you and your family cope. We want to hear from you. So please post your questions in the comment sections on whatever social platform you are joining us from this evening. We will be recording this event to share for those who could not join us live. So, to kick off this evening, I just wanted to share a few observations on what I'm seeing with my patients and families this school year, and then I will turn it over to my awesome panelists. And for me in adolescent medicine, this has definitely been a trying year. Mental health is very much on the forefront, and it has been wrought with difficulty seeing parents and families navigate balancing time, school schedules, whether or not their children are in school, virtually or hybrid. And I have definitely seen an increase in anxiety and depression, even with such things as, am I going to be able to play sports? Am I going to be able to see my friends? And their social lives have been disrupted. So I think it's very timely that we're addressing this mental health topic this evening. So let me start by introducing my first panelists, who each of them, after I introduce them, will share a little bit about give their introduction, their title, and a brief observation of what they're seeing so far this year. Let me first start by introducing Ms. Kirsten Myers. Kirsten.
Thank you, Lisa. Good evening. My name is Kirsten Myers. I'm the Director of Special Education at Kent ISD. I also oversee mental wellness and special populations. We are incredibly passionate about school-based mental health and supporting prevention and intervention efforts within a multi-tier system, and then really looking at decreasing that stigma around mental health. With the initial executive order and school closure last March, we were very focused on working with districts in identifying students that had moderate needs or those that were in crisis to get them the resources, the teletherapy, or care that was needed while they were learning remotely. This fall has looked a little bit different. We have aligned our efforts with the governor's Safe School Roadmap in providing guidance around the importance of social emotional learning for all students and in every classroom. Additionally, while we've been hyper-focused on students and family needs, we are also acutely aware of the needs in supporting our school staff, because this fall has been unlike any other, probably in the history of their educational career. There is an urgency to train staff in understanding the mental health signs and symptoms of their students, but also in identifying their own needs as it relates to mental health and prioritizing self-care and navigating the return to school this fall and in the midst of the pandemic. We're also working hard to build a stronger bridge between schools and community resources and supports.
Thank you. Next, I'll introduce Dr. Rosie Oliveiro. Dr. Oliveiro.
Hi, good evening. I'm Rosie Oliveiro. I'm a pediatric infectious diseases specialist at Helen DeVos Children's, and I'm the division chief of medical specialties at the Children's Hospital as well. And I'm also a wife and a mother of 3 young children. And so we have felt COVID-19 from all angles. as a physician at the Children's Hospital, really my role has been with helping our teams at Spectrum Health be prepared for the COVID-19 patients that come to our hospital. But also because pediatrics has really been very spared in terms of severe COVID-19, taken a lot of ownership of educating the community and trying to keep up to date on all of the ever-changing information about COVID-19 and helping community members really understand how we can best prepare and protect ourselves and our families and our loved ones. So my perspective as a pediatric infectious disease physician, luckily we haven't seen very many children who have gotten very ill from COVID-19, which is wonderful. We're obviously very happy that that trend has remained. But I think some of my most interesting observations are from having my 3 young kids and navigating through the pandemic from, the days that the schools were shut down and then navigating through schools reopening and getting back to school safely. And my observation really so far in that regard as a parent, in kind of wearing my doctor hat at various times as well, is that children really are, they're resilient and they can adapt very nicely to all of these changes. With appropriate support and guidance, I actually think that kids can continue to flourish despite all the strangeness and all the curveballs that 2020 keeps throwing at us.
Very good. Thank you. Next, Ms. Linda Van Houten.
Hi there. Thank you so much for having me as a part of this. I'm thrilled and honored to be able to be representing the school districts here. And we certainly have a unique perspective as we're trying to pave the way to meet the needs of all of our students and our families. We really have focused on recognizing that all of our kids are in a different place and our families are in a different place. So finding that balance of providing a continuum of services that meets everybody's needs has been the challenge for us. And so we've worked really, really hard to provide, services that support all of those entities for them, whether that be that in-person, which we're thrilled to be able to offer in-person education right now, but also online opportunities for our families, because we know some families are in a place that being in person is just not safe for them or they're not comfortable with that. So the focus is to make sure that you have that safe environment and meeting those people where they are at. Our safe environment has really focused on procedures and protocols and making sure that we have routines in place that everyone will follow to keep our schools safe. So excited about the work we've been able to do as a team and representing the needs of our student in that way. In addition, that mental health issue is real for us each and every day, recognizing that students need more support than just academic support. So our observations have been to first make connections and make relationships with students before anything else happens, as we know that learning can't take place unless students feel safe and feel connected to us as an adult. So making sure that we make contact with students each and every day, and that every single day a student has some kind of a positive interaction with an adult has been our focus. We also obviously are focused on the tracing pieces of it, that contact tracing piece, and being able to make sure that everyone has the information and communicating information to them on a regular basis. So it's been an interesting year. We know that change happens all the time, and dealing with the legislation and the issues going on there, but we're embracing it, and we're trying to just reinvent how education happens in the best way that we can.
Great. Very important. Those relationships are so much needed for our kids. Next, we have Dr. Ken Fawcett.
Thank you so much, Lisa, for having me be part of this panel. My name is Ken Fawcett. I'm a clinician by training, and I work in Spectrum Health Healthier Communities. It's a portion of our organization that does medical outreach to try to create the most equitable health outcomes possible in the communities that we serve. We have a robust school health program where we put nursing and nursing resources into schools that have historically been concentrating on physical health. And we've recognized that, boy, we have some real opportunities around mental health. So this is very, very timely. And we look forward to being able to really support those kids and their needs as they transition in the classroom, because their success in the classroom is going to translate to success in life. And we're very committed to that.
Great. That community outreach is so much important. Next, we have Ms. Marshamanceray.
Good evening, everybody. Thank you for having me here this evening. My name is Marshamanceray, and I'm an epidemiologist by training and currently the Deputy Health Officer for the Ottawa County Department of Public Health. I am not a mental health expert, but I thank you for the opportunity to discuss the important topic of mental health in schools, especially during this unusual circumstance that we all find ourselves in, as a worldwide coronavirus pandemic. As a public health professional, we define health very broadly. We're tasked with preserving and actually elevating the health of entire communities. We look at a population and their health. So in a pandemic, our role is to shoulder the primary responsibility of preventing the spread of disease in our jurisdiction, but it also means that stopping the spread of a virus is just as important as promoting the education of our children to have a thriving and healthy community. So education is a huge part of it. Since schools reopened this fall, our biggest challenge in public health has been the tension between preserving in-person education and battling the clusters and outbreaks of COVID-19 cases. We have Grand Valley University in our jurisdiction, and at one point they had more cases than any other college or university in the state of Michigan. That's been quite a challenge. The constant potential for administrators of schools, for teachers, and for students of going in and out of school because they could become a contact that's in quarantine or a case that's in isolation, or possibly have in-person learning suspended because of an outbreak is very stressful. So I'm glad we have a platform tonight to talk about this. And I'd like to take 1 second and maybe take down some shame and just admit right now, be transparent that I'm sitting here in my house in isolation as a case of COVID-19. And I've got my 10th grader here who's been out of school for 3 weeks as this goes through our household, this very contagious virus. And as he now has it, and the stress that I see in him as he tries to keep up with his schooling, battle boredom and fatigue and lack of social connection. So you're not alone out there, the rest of you.
Oh, thank you, Marsha, and thank you for sharing. And we definitely wish you and your family all the best. I mean, and so you even brought it right back into your home, just how it impacts you, and that I have to take my son out of school, and then, who do we tell? That shame and, having to tell. Thank you, and thank you for sharing. So I'll get to some questions right now. Let me first start with Kirsten here. More than 50% of Americans report experiencing a mental or behavioral health condition related to the pandemic. As we know, our children are suffering as well. How should we support all students social emotional learning in an in-person, hybrid, or remote format?
That's a great question. This year, and I stated this in my opener, but this year has been, and last spring, has been unlike anything we have experienced in the field of education. And certainly the health and safety of our students and staff is our top priority. With that said, and Linda said it really eloquently in her opening, but developing positive relationships with students need to be prioritized and will really set the stage for continued engagement, their participation, whether it be in a remote learning environment or face-to-face, as well as that social interaction that is so desperately needed, because we have many students that have not had that social interaction with their peers for months and months. So it will set the stage for that continued learning. And in considering the importance of the relationship between the student and teacher, we have recommended that teachers and other school staff intentionally connect with their students, whether that be in a large group, a small group, or individually as needed for instruction and for academic intervention, as well as mental health intervention. And then again, for that social interaction that's so critically important, especially right now. Additionally, the inclusion of a social emotional learning curriculum or social emotional learning in every single classroom is encouraged and should be prioritized for prevention purposes and to decrease the need for additional interventions that are more targeted and intensive in nature. And it really should be prioritized right alongside academic coursework. Social emotional learning, or a curriculum for social emotional learning, should really focus on teaching students skills. We assume that students come into the school setting with the skills needed around social emotional learning, but often that's not the case. So we need to take that on and really look at teaching students self-awareness, self-management, responsible and caring decision-making, relationship building, and social awareness. Additionally, the Michigan Safe Schools Roadmap supports the idea of doing universal screening for mental health upon students' return to school this fall. And if teachers are administering those mental health surveys and those mental health universal screening, they need to have that strong positive relationship with their students to be able to navigate that well. Additionally, those survey responses as a result of that universal screening gives us the opportunity to connect students right away with supports and intervention needed within the school setting, and then connect them to those community resources as needed.
Thank you. So I know I have a question for Dr. Oliveiro, but I'm going to go skip a little bit and talk about the school perspective and go to Linda here. And from a school perspective, how are all these additional stressors being managed in the school setting? So what are you doing?
Yeah, such a great question. And Kirsten hit it right on the nose. She is right when we talk about those support systems being in place. And she mentioned in her introduction about a multi-tiered system of support. And that's been critical for us to depend on that. So we do those screeners with our students, those mental health screeners, to identify the students that have those needs. And based on what we see through those screeners, we bring our professionals together and they meet every week to look through the list of students that are struggling or are showing signs that there's some social or mental health issues going on. And then we implement those supports. Those supports look very easily like a social work support or counseling support, or just a contact with another adult through a mentor system. We have nursing service available, so we may tap into that. But one of the best supports and resources that we have and available to our students is with a partnership with Spectrum. And that is a telemed on-site clinic that we have done through Spectrum United. And we have Spectrum staff that house themselves in an area in our high school that students can immediately get that mental health support. And it's a telemed system, so they come and they connect up through the clinician and immediately receive that support. One of the areas we find that is most difficult for students is accessibility. So to be able to access some kind of a health system through a health organization like Spectrum has been just incredible for our students. So it eliminates the barrier of transportation. It eliminates the barrier of trying to get an appointment with an entity that might provide counseling for you. And that accessibility has become key for us. So we've really focused on that. In addition, as we talked about in the introduction, is making those relationships. So we have a system in place to assure that every student has a positive relationship with an adult and has an interaction every day with them. So focusing on those types of things has really made a difference for our kids.
Wow, great. Wow, that sounds like some great partnership.
Yeah.
And so we talked this is great. This is awesome. Makes me proud to work for Spectrum.
You should.
So we talked a lot about the school resources, and I know Dr. Oliveiro, you have talked about even yourself being a parent during these trying times, but navigating all the decisions related to school and the pandemic, it can be overwhelming for the parents as well. What advice can you give parents on how to deal with that stress and help ensure that their children are healthy?
Yeah, I think this is a wonderful question. And, we zoom in and out all the time on focusing on the health of various people. And as a parent, especially parents, young parents, they may have children they're taking care of, and they may have their own parents that they're helping to take care of. So the burden can be pretty high. So first of all, I think it's important to just know and remind yourself very frequently that you're not alone, which may seem a little strange after spending potentially months in isolation at varying levels. But every parent has struggled with making decisions and taking in all of the information that's related to COVID-19. And of course, the minute you think you have something down and you understand it, the next day it'll change on you. So it is difficult, and it's hard to kind of keep on top of everything, but just realize we're all in the same boat. I'll just say myself as an example. I do infections all day and all night, and still I struggle on a daily basis with how to manage my family when it comes to mitigating the risk of COVID-19. So you are not alone. Second, I want to stress that it's super important for parents to go to reliable sources of information when they're trying to inform themselves to make decisions. So you can't do anything without hearing about COVID-19. But unfortunately, not always the people that you're hearing from or the sources you're hearing from have the most up-to-date, credible information that's useful for you. So just a few resources that I think are great, and they're just updated constantly and can be really nice resources for people. The Centers for Disease Control, or the CDC, has become a household name. Maybe you didn't think so much about CDC beforehand, but really they've been our source of truth when it comes to information about COVID-19, but then how to manage certain things from people in the community to healthcare workers. And so I really recommend going to the CDC website, and there's a wealth of information there about the risks of COVID-19 and how to protect yourself, even down to simple things like, how do I choose the right mask for my child? So I think that's a great resource. Your local health departments have great information on their websites as well. So it's probably a good idea to familiarize yourself with those. And then also Spectrum Health, Healthier Communities. I'll just give them a shout out. They have a section on school health, and I think they have some really wonderful resources on there that are timely and very relevant. So the appropriate types of information, I think, can really help soothe all the anxiety. We're obviously on a social media platform right now, but I do want to caution us about using social media to get your information, because we all have biases in how we post things about our personal lives. And I think that it can sometimes get us a little bit astray in our thinking. Oh, well, this person's doing this. Should I be doing this? No, I think when it comes to COVID-19 and thinking about the health of your family, these are extremely personal decisions. Not that you shouldn't be talking to people, but I think social media is not necessarily the best place to get your guidance on how to manage things in your family. And then third, I think a support system is absolutely essential. Whether that's your partner, a good friend, a family member, even the teachers at your local schools. Even if you're not in person, you're still connected to those teachers. You know, all of these different potential supporters have a different perspective, and all of us are going through things in different ways. And it'd be very, it's always very humbling to learn that somebody you maybe didn't think could help guide you really had a great perspective that could help you. So having that support network and leaning on them, as somebody mentioned earlier, this is not a time to be ashamed. This is the time to rely on each other. And in some ways, I think that this COVID-19 pandemic has brought out a lot in people and has connected people in some ways that weren't there before. So I encourage you to use that support network to try to navigate through all these important decisions they're very heavy for us.
Very good information. So reliable websites like Center for Disease Control, your local county health department, and Spectrum Health. And so we talked a little bit about already what there's a partnership with the telehealth at United, but Dr. Fawcett, how do you foresee Spectrum Health partnering with area school districts to expand behavioral health services in the schools?
Yeah, wonderful question, Lisa. And I do think that the mental health needs are going to be so vast that no organization is going to have the capacity or the resources to address them completely independently of one another. So collaboration is going to be absolutely key. I want to pick up on what Linda had described in terms of the creation of a behavioral health hub that is serving the students within the high school. We think that that is a strategy that we can scale. We can build upon the success that we have had with our school health program and offering something very, very similar, and utilize technology to be able to reach across broad geographies to assist students irrespective of the population density of their community or the size of the school. So we're looking to actively pilot a couple of behavioral health hubs that allow for us to do this. And we feel pretty confident that this will be something that we can be successful at. Between 80 and 90% of mental health services are now delivered virtually, either by telephone or through video. And students, our young adults, actually have a much higher comfort level than most of us that have gray hair in terms of utilizing technology to access some of these services. And I think Kirsten had discussed some of the barriers that students experience, particularly around accessing behavioral health services. And by having these be based in the schools with connections virtually, we can overcome barriers to access that include things like transportation and actually stigma, where we are allowing for student to student referrals. And we think that that's going to be highly effective.
Great. That is amazing. Great work. I mean, of course, I deal with adolescents, so I've had more than enough visits where they're just sitting there on the phone, on the couch, on the bed. But it's great and great interaction, and you can also kind of get a sense of what's kind of going on at the home. And so we talked a little bit about reaching out into our communities. This question is going to be for Marsha. Marsha, we've noticed that COVID-19 has taken a heavy toll on the Black and Latino communities in West Michigan. Reflecting on the long systemic health and social disparities, are there certain resources in our communities that you would recommend?
Thank you, Dr. Lowry, for bringing that up. That question really resonates with anyone who has watched the progress of the COVID-19 pandemic and the impact that it's had on our minority communities. And as a wife of an African man and as a mother of children who are, biracial, that definitely resonates with me personally too. I'd like to deal with this kind of from the pandemic point of view and then from the mental health point of view. For Ottawa County, we don't have a large Black population, but we do have a fairly large Latino population. They make up about 10% of our county. But at one point in May and June, really quickly, without us even realizing it, Latino cases were making up 40% of all of our COVID-19 cases. And that was a real wake-up call to our community. And it was a real wake-up call to public health. And when it comes to having communities that thrive and people that thrive, we learned again, the lesson that we have to keep learning is that there isn't a one-size-fits-all approach. If we want to take that kind of approach, some people will suffer disproportionately more than others. And so we had to pivot quickly as a community, and we needed to acknowledge the situation with quite a bit of humility and develop some solutions that had racial and cultural respect. We needed to lean on leaders in those communities. And so it is with mental health. And like my great co-panelists have already mentioned, it takes a community to solve these issues, and it takes partnership. And so, as was already mentioned with Spectrum, I would really look to some school-hospital partnerships. So if you're a family or you're a student or you're a teacher or you're a school administrator, school is a place to look first for mental health concerns and ways to address that, because they probably have relationships built already with providers in their community, and they're going to have culturally appropriate relationships built. And they also are quickly connected with families. And so they are that perfect neutral source that understands both sides and can really bring a lot of help. So look at schools and, check with your local community mental health agency or Network 180, and, kind of wrap that up with some physical health guidelines that are going to impact us. Remember to wash your hands, practice exceptional hygiene, exceptional prevention practices, wear your masks, socially distance so that your physical health will be exceptional, and that can help your mental and emotional health through this really difficult, challenging time.
Very good information. And I know sometimes people ask me, so how can we locate resources and support students? And I think my panel has already hit on it. School, community, your teachers. Of course, you can always call your healthcare provider. If you have insurance, you can always look on the back of your insurance card. Usually they have a number for behavioral health, but each county has a community mental health. So Ottawa has community mental health. Kent County, traditionally, we go through Network 180. But again, like you said, there are those resources out there So please contact, your schools, your healthcare providers for those resources. And like you mentioned eloquently, there's that community linkage. And I think a lot of people don't even realize that, like just we mentioned in United, there are those school services right there in the schools. And so it's not like an additional step, but there are people there that want to help you. And that's the other thing, I think, giving ourselves that grace during these times. I know I've been on several Zoom meetings, and parents are like, "Oh my gosh, I'm afraid that my child's running across the screen." Who really cares? I don't care if your child's running across the screen. But it's that sense, or oh my gosh, that grace, I haven't done this. So one of the things that I'm really trying to support families and our students was also giving yourself that grace, but also setting you up a schedule. So if you're doing at home schooling, this is the time you're supposed to be getting up and checking in with your teachers. And again, if you're having problems logging on, contact your school. Don't just be at home frustrated logging on. So I'm going to go back to some questions. Again, this one is for Kirsten. What are some of the warning signs parents and teachers need to be looking for when it comes to mental health of their child and our students?
I want to start by just saying that due to the continued uncertainty with the COVID-19 pandemic and public health actions, such as social distancing and the need for quarantining, this can cause a lot of feelings of isolation and loneliness. Additionally, students are navigating school in a whole new way, so are educators. And considering that they may be learning remotely right now, or they might be in and out of the school setting due to individual students or staff or buildings or districts that are going through periods of quarantine. So this is causing families and students and staff to stop and pivot and be ready for change and transition at a moment's notice, which really can be incredibly difficult on the family dynamic, as well as the educational system, in addition to the educational system. Therefore, we're really encouraging students and families and educators to not only check their physical health through watching for signs of COVID, such as a sore throat, cough, headache, etc., and taking their temperature daily, but we also want them to be taking a pulse on their mental health and connecting with school and or community resources for support as needed. We've talked about the school being a place for you to utilize with questions or concerns, and we can connect you. If we can't provide the resources in-house, we can connect you with where you need to be. As far as signs and symptoms, we are certainly seeing a lot of this right now, but sustained feelings of worry, dread, or panic, restlessness, or increased irritability that maybe wasn't there previous to COVID. Physical symptoms that have increased, such as upset stomach or headaches, difficulty sleeping, increased heart rate, or trouble thinking clearly are potential indicators of anxiety. Additionally, we are seeing rates of depression. They are significantly increasing since the pandemic, and likely due to some of these the social isolation, the quarantining, the inability to be with peers on a regular basis and having that social interaction. So therefore, when thinking about depression and signs and symptoms, seeing a prevalence, again, of sleep troubles or difficulties, more students that seem more lethargic in nature, maybe changes in appetite, poor performance in school, or decreased care for things they were previously interested in. Again, feelings of hopelessness or that ongoing sense that life and the future are grim, and especially right now as it relates to COVID-19 and when might we go back to normalcy and not knowing when that might be. These are all indicators for students and families to seek help through their school. Please contact your building administrators, our counselors, our social workers, any other mental health partners. We're seeing that within the school setting that many districts are hiring mental health liaisons or child life specialists. And these people are all there with knowledge and expertise to support families through this. And then we have resources and connections with our community mental health partners. Also, just in thinking about things that we can control around our mental wellness, we certainly want to advocate for our physical health by eating healthy foods, getting exercise, getting outside, taking walks, doing things that we can do. Getting enough sleep is critically important. We should also be, and I think this was mentioned earlier, but we should really be limiting the news and social media intake on COVID-19 because that can cause increased stress. Taking breaks from screens and social media and really promoting appropriately rated inspirational TV videos or movies. Also staying home and only going out when necessary, limiting the number of people that are coming and going, and really thinking about creative projects that you can do in the home, completing a big puzzle, building something with your own hands versus social media, or theme dinners, things that can get family members excited about being in the home together for long periods of time.
Great. Such great ideas. Thank you so much. So, Dr. Oliveiro, what should parents do if their child shows symptoms that don't allow them to go to school or they are told their children have to quarantine?
Yeah, this is a common question. If you haven't, as a parent, come up against it yet, you may, and I think it's good to be prepared for that because really the goal is to keep schools open and keep children in school as much as possible, and that really relies on us keeping children healthy in school. Now, not every illness that a child is going to come across right now is going to be COVID-19. And actually our data will show us that we have several other viruses that are circulating through our community. But because the symptoms of COVID-19 are so mild in children and they can be very nonspecific, we have to do our best in keeping children out of school if they are not feeling well. So a guiding principle I would say is this is the time to be honest, use your gut instinct, and not try to just tough it out through some symptoms that your child might be showing. So this is not the time to give a dose of Tylenol or Motrin and send your kid to school. It's a time to step back, think about monitoring your child instead of sending them to school, and be honest when you're responding to that school survey. I think most districts now have some degree of survey, whether you have to complete it every day or if you're supposed to look over it in the morning to see if your child is fit for school. And if your child does screen positive for a symptom that could be concerning, be honest about that. And then the next step will be calling into school and seeing what the next step is. It may be that you only have one mild symptom, your child has one mild symptom and they actually can still go to school. Or if they have two mild symptoms, they may need to be excluded from school for a period of time, or in some cases may need a COVID-19 test to come back to school sooner. So really the first step, because a lot of that's hard to kind of access in the moment, but I would say, when you're looking at that school screener, be honest, contact your school if there are possible symptoms, they will help guide you. And then our local health departments have done wonderful jobs in developing algorithms on when certain children can come back, depending on what their symptoms are and what their exposures might be, or if they need a test before they return back. So I think honesty is really huge here. And just a little anecdote: the third or fourth week of school being opened, I think it was a Tuesday, and my children were getting ready to go to school, and I just had these mild symptoms. One child had one mild symptom, the other child had another mild symptom, and if it was any other year, to be fully honest, I probably would have given them a little bit of Tylenol, said, hey, if you're feeling okay, go ahead, or just call me if you're not feeling well. But this year, we just have to do the right thing and take the kid out, use our doctors to help us guide us through whether or not they need further testing, again, with the county health departments and our schools. And luckily, everything was fine. They were back to school in a couple of days. So I think we all need to take that responsibility on ourselves and take it very seriously. Because if you think about it, even though your child might not have COVID-19, and you may think it's very unlikely they have COVID-19, but you decide to send them to school, and then two other children in their classroom get a fever, then think about that downstream effect that it will have on those families. So I think we all have to take that responsibility to take those symptoms and really do the right thing. Now, if you are contacted by your school and said that your child needs to quarantine because of a close contact with a known COVID-19 case, again, We're encouraging all of us to do the right thing, which would be to follow the quarantine guidelines, keeping out of mainstream, keeping your child home for monitoring for symptoms for the whole full period of time. And I think in my experience, the school districts are becoming more and more prepared for how to handle that. If you're in quarantine, generally speaking, you're feeling pretty fine, but you just can't go to school. So hopefully your educators can help provide resources for your child to continue and be engaged with education, even though they're at home. Because again, we really don't want those downstream effects of other children being affected and then, ending up with a larger community spread or affecting people who could be very severely or life-threateningly ill from COVID-19.
So definitely being more cautious. Thank you, Dr. Oliveiro. Linda, this question is for you. We know that there's an emotional toll that's also affecting teachers and school staff. How are you navigating that, and what resources have been put in place?
Yeah, great question, because it's so true that this is not just impacting our students, but our staff have come upon such a change in their protocols and procedures and just how we do business in a school. And that's taken its toll on our staff, to be honest. They care so much about our kids, and they're used to being in person. That's how their training has brought them to be a teacher. And then for us to say, guess what, you're going to do some lessons online. Guess what, you're going to meet your kids online, has really thrown a loop to them. So we really started out providing training for our teachers at the very beginning of the school year and took several days to introduce them to different ways to connect with kids and engage with kids through social media and through the vehement of technology. And we wanted to make sure that they were prepared and felt comfortable reaching out to them and using that. And that helped reduce a little bit of their stress so that they had some tools in the toolbox to connect with their kids in different ways. But the other piece is that we continue to do exactly what we do for kids, and we maintain those relationships. So we spent some time with our administrators to talk about how important it was that administration makes positive contacts with staff and keeps tabs on them. We did a survey with our staff, just like we do a survey with students, to say, how are you feeling? How comfortable are you at being at school? If we had teachers that were not comfortable being there or were concerned because of issues of health in their own homes, we provided different options for them, and were able to provide a different vehicle for them to still participate in teaching, but maybe it was online so that they could stay safe in their home. In addition, we're offering some things through our insurance packages that offer counseling support and mental health supports through community mental health programs to make sure that their needs are being met. Because we know that if we have their cup that is not being filled and meeting their needs, they're not going to be able to fill the cups of our students. And so it's so important that we provide those resources to our staff and make sure that they're healthy and ready to give back to those kids.
Wow, thank you. So we have about 4 minutes left. I'm going to try to do that between the last two panelists. First question is for Marsha, and it will be, when we face a crisis, what approach should folks take to help address our mental health?
Just like this pandemic, the communities that faced it best were the communities that didn't make it an us versus them issue, but they came together, they reached out, and they helped each other. And the same is with mental health. And I hope that the people listening will hear the message that everyone has mental health needs at times. And right now, there isn't a single one of us who's unaffected by this pandemic and stressed or struggling in some way. So there's no shame in asking for help. In fact, there's courage in asking for help. Reach out, because mental health issues can often be isolating and cause us to draw inward and kind of feel ashamed. So reach out to others. There are people at school, there are people in your community that are there to help.
Thank you so much. And Dr. Fawcett, last question. How important are partnerships when addressing the issues of mental health in our schools?
Well, again, Lisa, I think they're absolutely essential. The schools may be able to construct a classroom setting to help support kids that have special needs, but we need to be able to have a gradated approach to this so that the schools can supply one level of need. We can then rather rely on community partnerships to supply other interventions, and then reserve those with the most significant needs for the highest level of intervention. And so it is clearly an issue where one size doesn't fit all, and it's going to require having multiple resources at bay that can be deployed to really address a whole series of issues, but it's going to be best through collaboration.
Great information. This time always goes so quick with these panelists, and I'm always delighted to have such great information. I was delighted to have all the information about the partnerships and everyone, what's going on in our communities and our schools. Thank you all for joining us for Spectrum Health's second school health virtual series. And thank you to our dynamic panelists for participating in tonight's dialogue on staying healthy during this school season. We plan to share the recording on our website, spectrumhealth.org, where you can find many resources to help you stay healthy and well in this back to school season. We look forward for you joining us for future sessions on stay healthy and well and the difference between flu versus COVID. Thank you and have a great night.